The JAVELIN 100 trial was a trial conducted as first-line therapy, that in fact it was first-line therapy connected to maintenance therapy. Patients who had bladder cancer, metastatic, locally advanced, that were receiving cisplatin-based chemotherapy, either cisplatin-gemcitabine or carboplatin-gemcitabine. If they did not progress, they were randomized after 4-6 cycles to receive Avelumab maintenance plus best supportive care or best supportive care alone. And this happened in between 4-10 weeks after completing the 4-6 cycles of chemotherapy. The main endpoint was overall survival, and the results of this trial were published in the New England Journal in 2020, where for the first time giving maintenance Avelumab in patients that did not progress to first-line chemotherapy, a survival benefit was observed. The median difference in survival was 7 months in patients, comparing Avelumab maintenance versus best supportive care.